Hello, and welcome back to the COVID Longhaulers Podcast. We share real stories from those living with long COVID, what they faced, how they're coping, and surviving. My name is Emerson, and I'll be hosting this episode today with Jessie.
Hi.
Like many people with long COVID, we spend a lot of time learning about it, and just as much time trying to explain it to others. But we found that it's really hard to talk about long COVID when not everyone understands the basics. So, in this episode, we're going back to the fundamentals. We'll be looking at what the term long COVID means, what the common symptoms are, as well as the leading hypotheses about what causes it. There is still so much that we don't know about long COVID, but what we do know deserves to be shared.
We, the COVID Longhaulers Podcast team, have done our best to keep this episode as clear and accessible as possible. We hope it can serve as a useful guide, whether you're newly diagnosed, wondering if you might have long COVID, or simply want to better understand this condition that's affecting more and more people worldwide. But please note that while we did thoroughly research the information for this episode, that it is not medical advice and should not be used as such.
Yes, and I would also like to remind you that we do have a glossary linked in our show notes with all of the relevant terms that we will use in this episode. And as always, our sources are linked in our Substack post, which is a written version of this podcast episode that you can also find linked in our show notes.
All right, so what exactly is long COVID?
Well, long COVID is one of the many infection-associated chronic conditions, meaning that it is a long-term illness triggered by infection. This means that you develop long COVID after an acute COVID infection. And long COVID is not contagious. You cannot get it from someone else. You can only develop it as a result of your own acute infection.
Yeah, so the definition of long COVID has been a subject of debate and advocacy for years now. The term was first coined by patient advocates who found themselves struggling to recover from their acute infections as early as spring 2020. In the past, researchers have also used more basic definitions of any symptoms persisting beyond a certain time point, like 2 weeks, 6 weeks, but usually 3 months. This can make talking about long COVID confusing, as it can refer to both the chronic condition as well as the larger umbrella of post-COVID health complications. This is also problematic because there are studies that define a long COVID cohort as people who had persisting symptoms for 2 weeks after the initial infection, for example.
Yeah, so the World Health Organization generally defines long COVID as any new symptoms and illnesses that develop after an acute COVID infection that lasts for at least 2 months after the initial infection has passed. But this definition is really vague. So in 2024, the National Academies of Sciences, Engineering, and Medicine published a paper with the consensus definition of long COVID. And that is, quote, long COVID is an infection-associated chronic condition that occurs after SARS-CoV-2 infection and is present for at least 3 months as a continuous, relapsing and remitting or progressive disease state that affects one or more organ systems, end quote.
So, long COVID is inherently an umbrella term for any and all new or worsened symptoms that persist for longer than 3 months after a COVID infection. The main addition here to that WHO definition is the specification that long COVID can take on various forms as a relapsing and remitting or progressive disease, and that it affects at least one organ system. This definition is broad enough to cover all different types of long COVID, as symptoms and development through time vary widely, patient by patient.
But this definition still doesn't clarify whether the development of other infection-associated chronic conditions post-COVID are also part of the long COVID umbrella term. These other infection-associated chronic conditions include conditions like POTS, postural orthostatic tachycardia syndrome, which affects your heart rate when standing up, mast cell activation syndrome, or MCAS, which causes inappropriate severe allergic reactions, and MECFS, myalgic encephalomyelitis, or chronic fatigue syndrome, which causes extreme fatigue that is not relieved by rest, among other things. More and more recent research is pointing towards such conditions being a large part of long COVID. Many long haulers, myself included, are diagnosed with these conditions down the road. And that means that we, the COVID Longhaulers podcast team, generally define long COVID as a collection of possible infection-associated chronic conditions like POTS, MECFS, MCAS, etc., as well as the collection of possible post-COVID organ damage that can cause persistent symptoms as well. So when we talk about long COVID, that is the definition that we are using.
Research published by long COVID researcher and expert Dr. Ziad Al Ali has also found that people can develop long COVID up to 2 years after their acute infection and does not necessarily occur directly after the acute infection is passed. This isn't included in the official definition and can make the process of diagnosis far more complex for affected people.
Yeah, absolutely. So now that we have a general broad idea of what long COVID is, Jesse, who is at risk of developing long COVID?
Well, it's a myth that long COVID only affects specific groups in society, such as the elderly or previously disabled people, although we know they are at higher risk. We know that anyone who has had a COVID infection can go on to develop long COVID. It does not have to have been a severe infection either. A more severe infection does increase the risk of long COVID, but most long COVID cases, over 90%, are caused by a mild infection due to the much larger number of mild infections. We know that asymptomatic SARS-CoV-2 infections can also lead to long COVID. One meta-analysis found that 17% of people had long-term symptoms after an asymptomatic infection. And of course, organ damage can be significant in asymptomatic cases. As much as 57% of people experience lung damage, for example, which can contribute to symptoms of long COVID. The risk of developing long COVID also increases with each infection. One study from the patient-led research collaborative found that at 2 infections, you are a little over 2 times more likely to get long COVID than those with only 1 infection. And at 3 infections, you are nearly 4 times more likely to get long COVID.
Of course, there also are certain groups in society that seem to have an elevated risk of developing long COVID. More research is needed to understand why that is the case. But long COVID predominantly affects females. They are 31% more likely to develop long COVID than their male counterparts. People of color and transgender people also have a higher long COVID risk. And of course, having a disability or chronic illness can also elevate your likeliness of developing long COVID. These include conditions like hypermobility, neurodiversity, autoimmune diseases, allergic conditions, etc.
So, how many people actually have long COVID?
Well, Jesse, that question is hard to answer because there are simply so many variables that determine the rate of long COVID in the population. And of course, different studies use different definitions, and all of that leads to very unclear numbers, as you're about to see. In 2024, a study estimated that around 400 million people worldwide are living with long COVID, and this number has likely increased as people continue to get infected with COVID. And as you mentioned, repeat infections do elevate the risk of developing long term health issues. And the estimates on prevalence do vary widely. For example, the World Health Organization suggests that around 6% of people develop long COVID, while a UK study found that roughly 1 in 10, so 10% of people, develop long COVID post infection. Many researchers have placed the rate somewhere between 10 and 35% among those who have had COVID-19, but a recent review by investigators from the University of Michigan and the Yale School of Public Health, which analyzed studies up to July 2024, reported a pooled global prevalence of 36%. This suggests that around 1 in 3 people with confirmed COVID-19 go on to experience long COVID. So it is clearly too early to determine the true prevalence of long COVID because the estimates vary widely between 6 and 36%. And of course, there are population level factors such as vaccine uptake, access to medical care, reinfection rates, underlying health issues, as well as other social disparities that play a role in how prevalent long COVID is in a population.
Yeah, it's also worth stating that a study in the US found that long COVID is now the most common chronic illness in children, affecting almost 6 million children in the US potentially. This is higher than the number of children with asthma, which was previously the most common chronic health problem in children.
Yeah, scary to think about.
Yeah. Hmm.
So, long COVID is incredibly widespread and probably way more common than most people would believe. But, Jesse, what does it feel like to be living with this condition?
Well, as long COVID is a complex, multisystemic condition, it has over 200 identified symptoms that can affect various organ systems. Some of the most common symptoms include fatigue, brain fog or cognitive impairment and memory issues, PEM, as in post exertional malaise, shortness of breath, chronic cough, loss or alteration of taste and smell, sleep disturbances, new or worsening allergies and food sensitivities, depression, anxiety, and other mental health disorders like depersonalization and derealization, reproductive system dysfunction, heart palpitations and chest pain, gastrointestinal issues including reflux, stomach paralysis, diarrhea, and constipation. These symptoms vary among individuals. Not everyone with long COVID will have the exact same symptoms. Sometimes you're lucky to have all of them. I doubt that you will ever find two long haulers who experience the exact same symptoms in the same severity.
It is also really important to note that long COVID can affect any and all organ systems in the body, as COVID is known to cause widespread organ damage. So, COVID can impact the heart, the lungs, digestive system, pancreas, kidneys, liver, etc. And it can, of course, also harm the immune system by sharply reducing T cell numbers and simultaneously triggering an excessive inflammatory response, also known as a cytokine storm, that exhausts the remaining immune cells and disrupts normal immune function. For anyone who wants to learn more about that, we discuss this immune response in more detail in episode 8, The Invisible Damage of COVID 19. So, for this reason, the damage that SARS-CoV 2 can leave behind in the body may seem random, strange, or hard to believe. And that is why these symptoms span the whole body and affect pretty much all systems or organs in the body.
Looking more closely at people with long COVID, we see different long COVID subtypes. Some patients report having more neurological symptoms, some more gastrointestinal symptoms, but most have a combination of symptoms that can span the whole body. Studies have often grouped patients that fall under a similar set of symptoms as phenotypes. However, since the underlying mechanisms are still opaque, there's really no consensus about how to define cohorts of patients.
And your symptoms can also evolve through time. This is what is meant by the relapsing and remitting part of the long COVID definition. So symptoms can change, improve, or get worse, or completely new ones can pop up too. This can be caused by repeat COVID or other infections, as well as ongoing immune dysregulation, or can be caused by PEM crashes that can temporarily or permanently alter your baseline.
Long COVID can also be incredibly disabling and can cause significant difficulty participating in your day-to-day life. Some patients may be able to participate in some proportion of everyday activities as normal, while others might be homebound or bedbound, unable to work, go to school, or live the life they had previously envisioned for themselves. A study published in June 2023, led by researchers at University College London and the University of Exeter, revealed that many individuals suffering from long COVID experience a health-related quality of life that is incredibly low. Participants were given a questionnaire to assess health-related quality of life across 5 dimensions: mobility, self-care, usual activities, pain or discomfort, and anxiety or depression. The findings indicated that long COVID patients reported significant impairments in these areas, with their quality of life scores often falling below those of people with advanced metastatic cancers, such as stage 4 lung cancer. Overall, the impact of long COVID on the daily activities of patients was worse than that for stroke patients and comparable to people with Parkinson's disease.
Yeah, wow. I
Mhm.
remember reading that study and feeling so validated because this probably sounds shocking to anyone who has never experienced long COVID, partly because of how the media has downplayed it.
Mhm.
And so many people still think that this is some mild or temporary illness. But for those of us living with long COVID, this study is really proof of how severely disabling this condition is and how it needs to be taken more seriously.
Mhm. With such a wide range of symptoms, diagnosing long COVID isn't simple. Since long COVID involves over 200 symptoms, as we said, organ damage and post infection conditions, there is currently no single diagnostic test for it. Right now, there's no blood test, no scan, no biopsy that can tell you for sure if what you're experiencing is due to COVID.
And that's why long COVID is considered a diagnosis of exclusion. What that means is that your healthcare provider will usually run a variety of tests. And that is not to confirm that you have long COVID, but it is to rule out any other possible causes of your symptoms.
Hmm.
For example, they might test for conditions like certain cancers, multiple sclerosis, COPD, which is essentially chronic lung damage, or other diseases that could overlap with the symptoms that you are experiencing. So, in practice, this means that your provider will look at a few things. They will look at your medical history, whether you recently had a COVID infection through a positive test or based on symptoms, as less and less people are testing for COVID nowadays. And they will also do health examinations just to get a clearer picture of what you're dealing with. Depending on your symptoms, you might also be tested for specific conditions. So, typically, that will be infection-associated chronic conditions that are known to develop after viral infections and, of course, specifically after COVID. For example, dysautonomias like POTS are fairly common after COVID. So if you're experiencing things like dizziness or a racing heart when you stand up, your provider might refer you to a specialist for something called a tilt table test, which is used to diagnose POTS.
So, what comes after the diagnosis? What are the treatment options that are available to long haulers?
So here's the thing, there aren't really any treatments available to us. Treating long COVID is just about as complex as diagnosing it, and the reasons are pretty similar. Everyone has different symptoms, no two cases are the same. So there isn't one treatment that works for everyone. And on top of that, because the underlying causes of long COVID aren't fully understood yet, there are no treatments that treat the root problem. And as of now, there's also no cure.
Instead, treatments focus on managing symptoms and improving quality of life. Since there isn't a specific medication for long COVID, most prescribed drugs are off label, meaning they were originally approved for other conditions, but are being used here to help with long COVID symptoms. This can be frustrating, especially because not every healthcare provider is familiar with the latest information on long COVID or with the options for off label treatment, and often off label medications aren't covered by insurance. The type of medications or therapies you might be offered depends heavily on your individual symptoms. For example, if you're dealing with shortness of breath or chest pain, you'll be prescribed different medications to those with dizziness, fatigue, or brain fog.
And because long COVID is complex and multisystemic, ideally treatment should involve a team of specialists from different disciplines who work together to piece together what's going on and how they can help. But the reality for most people with long COVID is very, very different. Access to coordinated healthcare is limited, and most patients find themselves bouncing between specialists who often don't communicate with one another, stuck on long wait lists, and trying to connect the dots on their own. In practice, a lot of us with long COVID end up self managing our symptoms, advocating for ourselves, and in many ways acting as our own doctors.
But here's a hopeful update. In 2025, new clinical guides were published to help doctors treat long COVID and related post infection conditions. Mount Sinai, a research and treatment center for long COVID in the US, released the first ever manual for infection associated chronic illnesses, and the Bateman Horn Center, a nonprofit formed to improve the lives of people impacted by ME/CFS, created a detailed clinical care guide for long COVID and ME/CFS. These resources are designed to give providers practical tools and make care more consistent so patients don't have to start from scratch every time they see a new doctor. I've found these guides incredibly important and helpful as a patient. I can read up on my symptoms and can find out if there are tests available to find out what the underlying issues might be and how it can be treated. We're still far away from proper treatment plans, but these guides are an important step in the right direction.
Yeah, so these two guides will be linked in our Substack post in our show notes. And we will also be linking a treatment guide by a Swiss long COVID and ME/CFS specialist in the show notes, as it is much shorter and likely more helpful for people living in Europe, where we deal with different guidelines and standards of care. These, of course, vary in European countries, but it might be taken more seriously than a guide from the US. So, Jessie, besides conventional medicine, what other treatment options are there?
Since conventional medicine doesn't really have the answers and treatment options many long haulers are looking for, many turn elsewhere in hopes of finding relief. If you've been following our podcast for a while now, you've likely heard our guests talk about the newer experimental and alternative treatments they've tried to manage their long COVID, such as acupuncture, hyperbaric oxygen therapy, nicotine patches, mind body therapy, etc., as well as a variety of supplements. As of now, the efficacy of these treatments for long COVID hasn't been proven. In most cases, some small trials have shown some improvements, but these findings haven't yet been replicated in larger trials with proper control groups. It's also not yet known which long COVID subtypes or phenotypes improve with what kind of treatment. Sadly, many of these treatments are expensive and not covered by insurance, meaning that they are out of reach for many of us with long COVID.
But if you still want to learn more about the different kinds of experimental treatments that can help manage long COVID symptoms, you can check out our interviews with long haulers, where a lot of people have discussed the treatments that they have tried in the hopes of recovering and improving their health. In the Substack post linked in our show notes, you'll find a link to a list of episodes with some information about the topics and treatments we discussed in each episode.
To really understand why long COVID behaves the way it does and why some people improve while others don't, we have to look inside the body. So, Emerson, what's actually happening on a biological level?
Jessie, before we get into all of that, I think it's really important to briefly explain how COVID actually gets into the body and how that initial infection can lead to not just the acute illness, but also long COVID as well. So, SARS-CoV-2, the virus that causes COVID-19, enters the body by attaching itself to a specific receptor on our cells called the ACE2 receptor. You can think of the ACE2 as a kind of doorway that the virus uses to get inside. And these receptors are found in the nose and lungs, which is why COVID often starts as a respiratory infection, but they're found all over the body, including the heart, blood vessels, gut, kidneys, and brain. So once the virus binds to the ACE2 receptor, it uses our own cells to make copies of itself, and this damages infected cells and triggers inflammation as the immune system tries to fight back. In the short term, that's what causes the COVID infection and causes the typical COVID symptoms like a fever, cough, and shortness of breath. But because those ACE2 receptors are so widespread, the virus and the inflammation it causes doesn't stay confined to the lungs. It can affect blood vessels, disrupt normal blood flow, interfere with how organs communicate with each other, etc., etc., etc. And on top of that, the immune response itself can sometimes become overactive, causing further tissue damage.
So, this is why COVID is not only considered to be a respiratory infection, but also a vascular disease.
Yeah, exactly. And for many people, the immune system eventually clears the virus and calms down, and then you recover from COVID and you're more or less fine. But in others, something goes wrong, leading to the widespread organ damage and multisystem symptoms we see in long COVID.
Doctors Ziad Al-Ali and Eric Topol, two respected experts in the long COVID world, wrote an excellent article for the journal Science titled Solving the Puzzle of Long COVID, where they explored the hypothesized mechanisms of the disease. In this article, they lay out 5 possible mechanisms or pathogenic pathways that may explain what's driving this condition. And I'm going to list them here, 1 through 5. Number 1, viral persistence. 2, immune dysregulation or autoimmunity. 3, mitochondrial dysfunction. 4, endothelial and neuronal inflammation. And 5, microbiome dysbiosis.
What does all of this mean, Jesse?
Well, viral persistence is exactly what it sounds like. Somewhere in our bodies, the virus is still lingering. We've known that some viruses can do that for a while. Viruses like HIV, HPV, and HSV can all persist in the body, and there's no reason to assume SARS-CoV-2 couldn't. So it's possible SARS-CoV-2 does the same, hiding in hard-to-reach tissues. If that's happening, the immune system senses a threat but can't fully clear it. This keeps the immune system switched on, eventually exhausting the T cells and wearing the body down. Experts such as Dr. David Putrino, a well respected long COVID researcher, has shown evidence of prolonged T cell activation in long COVID patients, which may also explain why we're seeing the reactivation of latent viruses like shingles in young people or tuberculosis in otherwise healthy individuals.
And that brings us to the second mechanism on the list, which is immune dysregulation. After COVID, many immune systems simply don't work the same anymore. Studies show that COVID can damage several important parts of the immune system, including T cells, which help coordinate immune responses and kill infected cells, dendritic cells, which alert the immune system to threats, and even the complement system, which helps the body fight off infections. The Polybio Research Foundation, a US based nonprofit research foundation focused on studying how viral, bacterial, and parasite infections contribute to chronic diseases, including long COVID, recently found that natural killer cell levels are reduced in long COVID patients compared to people who cleared the virus successfully. And on top of that, we're seeing new autoimmune diseases develop post COVID, which is further evidence that immune disruption is real. For example, an analysis published this month, January 2026, found that COVID-19 was associated with a 49% increased risk of new onset autoimmune related diseases.
Wow. We also have number 3, mitochondrial dysfunction. You might remember from school that mitochondria are the powerhouses of our cells. When they don't work properly, cells struggle to produce energy. That could explain long COVID's hallmark fatigue and muscle weakness, along with post exertional malaise, the severe crash many patients experience after even minor activity.
Yeah, and fourth, we have endothelial and neuronal inflammation. Endothelial inflammation refers to inflammation of the lining of the blood vessels. We know that SARS-CoV-2 damages the endothelium, and this damage can have serious repercussions throughout the body. When the endothelium is damaged, it can lead to abnormal clotting, leaky vessels, and reduced blood flow. These problems affect multiple organs, which help explain the widespread organ damage observed in long COVID patients. Long COVID researchers have identified unusual fibrin amyloid microclots, tiny abnormal clots that trap other molecules inside of them. And these microclots are now a major focus of research, both as possible biomarkers and as targets for new treatments. And this virus can also affect the brain. COVID is able to cross the blood brain barrier, which is a protective filter designed to keep pathogens out of the brain. And once that barrier is compromised, inflammation spreads to neural tissue, leading to symptoms like brain fog, memory problems, and headaches. In some patients, the barrier remains leaky long after the initial infection, leaving the brain vulnerable.
That's terrifying.
Yeah.
Finally, and this one is near and dear to my heart and my gut, microbiome dysbiosis. The microbiome is the community of microorganisms in our gut that play a key role in digestion and immune health. Studies have shown that long COVID patients often have disrupted microbiomes, especially those with gastrointestinal symptoms. In fact, a 2022 study found SARS-CoV-2 antigens persisting in the intestines months after mild infection, suggesting viral persistence may actually be driving this imbalance.
The important thing to note here is that these mechanisms aren't necessarily separate. They may all be working together like a domino effect. Viral persistence can spark immune dysregulation. That can lead to inflammation, clotting problems, mitochondrial dysfunction, and gut dysbiosis might amplify the whole cycle. In this way, that one tiny pesky virus sets off a chain reaction that spreads through multiple systems of the body, producing the wide and often bewildering range of symptoms that we see in long COVID.
But more research is still needed to understand just how these mechanisms are intertwined and connected, and what the long term effects of this damage might mean for those living with long COVID.
All right. So, Jessie, having discussed all the science now, how many people actually recover from long COVID?
Well, once again, there is no single and simple answer to
Yeah.
this question. It's hard to know exactly because different studies use different definitions, populations, and follow-up timeframes, and because people just keep getting infected. For example, a study in The Lancet, a weekly peer-reviewed general medical journal and one of the world's oldest and most prestigious medical publications, from April 2025 showed that the overall resolution rate for long COVID was less than 2% in their study population, even 3 years after the initial infection.
Wow.
Another study from the Mayo Clinic in the US that was published in 2024 found only 4.5% of participants rated all their symptoms as very mild, so near recovered, about 23 months after initial infection. But according to the World Health Organization and a different study from the University of Zurich in Switzerland, only about 15 to 20% of long haulers still have symptoms 2 years after their infection. So while the likelihood of full recovery is still unknown, with newer data pointing towards lower overall recovery rates, some people with long COVID do experience improvements through time and can stabilize and manage their symptoms through medications and treatments. And this is kind of where I consider myself, where 3 years later, I'm at the point where I can manage my triggers enough that I can live more of a life. However, the likelihood of recovery and improvement depends on quite a few factors such as age, race, sex assigned at birth, pre-existing conditions, or access to health care. The COVID onset symptoms and conditions also play a role in one's likeliness to recover or experience improvements. According to the Swiss study I mentioned earlier, those with symptoms such as altered taste and smell, fatigue, brain fog, or post-exertional malaise, PEM, were less likely to experience improvements or recovery as time passed.
Personally, I hate the word recovery. I hate it. I was given so many recovery roadmaps from so many different medical providers at the beginning of my long COVID journey, and nothing like that ever happened to me. I never recovered the way I was told I would. When I think about recovery, I think about my body healing itself. I think about being cured, no longer depending on medication and pacing and all these changes I've made to my life to function that I can just be and do what I want. And so for myself, when I think about where I am now, I think about the medications that I take as symptom management and maybe improvement, because that is all that it is. It is suppressing my symptoms so I can function. But I am not recovering in the sense that my body is healing itself and I am fixed or cured.
Thinking of recovery in terms of recovering ability to do
Yeah.
activities is more realistic than recovering your health because it's like we're
Yeah.
always managing 8,000 different symptoms and triggers or whatever, but we may be able to do that as we recover more ability to take a walk or potentially get a job eventually.
Yeah.
That doesn't mean we've recovered. It just means we've gotten a little bit more ability
Yeah.
back.
People define these things so differently. A lot of people also say that you can't recover from COVID, that you can only go into remission, the same as cancer, which I personally understand because we have the constant risk of getting reinfected with COVID and getting long COVID again. So, how can we actually recover from long COVID when society is constantly putting us at risk of developing long COVID again? I also want to note that long COVID isn't always a condition that simply gets better over time. As discussed earlier, long COVID can be progressive for some people, meaning that symptoms actually worsen as time goes on. And this can look like increasing fatigue, worsening neurological issues, or the development of new complications months or even years after the initial infection. So the long-term outcomes for people with long COVID are highly variable, ranging from gradual improvement to plateauing symptoms to a progressive decline, depending on a mix of biological, medical, and social factors.
Hmm. So, where does that leave us? What does that mean for us long haulers?
We're living with life-altering and often disabling symptoms, yet modern medicine still has no roadmap for diagnosis, no proven treatments, and there is no coordinated plan for recovery. And that is not because the science behind long COVID is impossible to understand or because we don't have the right technology to figure these things out, but just because the research ecosystem has failed us. Funding has been inconsistent and inadequate, and the studies that do exist are often designed in ways that could never produce meaningful answers. A major driver of this chaos has been a lack of a consistent and universally used definition of long COVID, which blurs the lines in research and makes it nearly impossible to compare studies, identify subgroups, or even build a unified scientific foundation.
Researchers are also rushing into treatment trials without first establishing clear long COVID subtypes, even though different biological mechanisms will inevitably respond to treatments in different ways. That lack of basic groundwork has already caused multiple trials to miss statistical significance, not because the treatments were useless, but because the studies were never structured to succeed. And this isn't a new story. Infection associated conditions like ME/CFS, POTS, and MCAS have been dismissed for decades, often written off as hysteria or psychological problems, even when clear physiological abnormalities were present. Now, long COVID is being pushed down that same path, met with the same lack of care, urgency, and scientific seriousness, and with patients once again being told they can simply, quote, mindset their way out of a condition that is very physical and profoundly disabling.
Yeah, and this kind of neglect has left us to not only have to research and understand this completely new virus, but now we're also playing catch up with things like MECFS, POTS, and MCAS because these conditions were never taken seriously or properly researched. And if they would have been taken seriously from the start, we might have biomarkers for MECFS and POTS. We might have a better understanding of why they happen after viral infections. We might actually be closer to treatments that could help with these conditions. But alas, we don't. And this lack of medical understanding, care, and treatment has severe consequences. Many of us are forced into precarious situations because we cannot prove that our symptoms are real. We are unable to work, unable to access the resources we need to survive, and are navigating systems that were not built for people like us. These systems, combined with the medical neglect that so many of us experience, harm us, make us crash, and become sicker as time passes. And some of us don't make it. People have died and continue to die because of medical neglect, because their symptoms are dismissed, and because life saving care is withdrawn, because their disabling symptoms are not taken seriously. Meanwhile, the public conversation treats COVID as if it were over, as if it were this mild cold that we as a society can move on from. But this narrative is false and dangerous. It makes the virus seem harmless when COVID is in fact a mass disabling event. And it makes people less careful, less compassionate, and sometimes even hostile towards those of us whose lives were upended by it.
What we long haulers need is change. We need serious, sustained research into long COVID and post viral conditions. We need
Yep.
policymakers and other people in power to finally recognize that the pandemic never ended and to recognize that we must implement measures for clean air. We need medical
Yep.
professionals to be educated about long COVID now so patients don't have to fight for care or legitimacy every time we walk into a clinic.
Yeah, and it cannot be on the shoulders of the sick and disabled to carry all the advocacy, awareness, and education work, not when so many of us are barely surviving.
Hmm.
So, to any researchers, policymakers, or healthcare providers listening to this, we need you. We need you to recognize COVID and long COVID as the crisis that it is and to act on it. And to everyone else listening, please take this seriously. Protect yourself and others. Wear a high quality respirator when you're in public. Isolate when you are sick. And stay up to date with your vaccinations. The only way not to get long COVID is to not get COVID in the first place. And if
Hmm.
you're going around careless, unmasked, in public places, you're going to end up with COVID and maybe even long COVID. So please, spread awareness and advocate on our behalf.
Yeah, and do you really want to be one person in a chain that ruins someone else's life through an infection? You know, that the rules of 2020 are still here. The choices you make in public with infection control have repercussions for others, whether you want to believe that or not.
Yeah, so wearing a mask can help save someone's life. and it
Mm-hmm.
can prevent someone from becoming severely disabled.
Like us.
So help us normalize masking in public.
If you are in the position to, it would mean a lot to us and many other long haulers if you would donate to a long COVID charity, like a long COVID research and advocacy group. Long COVID is a crisis hidden in plain sight, and the neglect must end. You'll find a list of organizations to donate to in our show notes.
Please donate and support us in any way that you can. Thank you so much for joining us today and listening to this podcast episode. If you would like to learn more about long COVID, I recommend you check out some of our previous episodes. We can highly recommend episode 7 from Long COVID Awareness Day last year, as it offers insights into life with long COVID. Episodes 2, Vegas Baby, and episode 6, New Daily Persistent Hell, discuss some of the lesser known symptoms of long COVID. In my episode, Emerson is Lost, which is episode 3, I talk about living with POTS and back then still undiagnosed ME/CFS. I honestly hate listening back to that episode because I was still full of hope for recovery. But for more information about ME/CFS, I can recommend listening to episodes 9 or 12. As always, while our discussions offer medical related insights, this is not medical advice. Always consult your healthcare team with any of your medical concerns. If you'd like to connect with our community, you'll find a link to our Discord in our show notes, along with our Substack and socials. We aim to release episodes monthly, so please subscribe and stay tuned for future episodes. Until next time, this is the COVID Long Haulers Podcast signing off. See you on the next one.